So on a more global scale, when we look at something like maternal mental health, what do you think, places, low or middle income countries that maybe do not have the same sort of resources where maternal mental health is really not even on the agenda yet? What do you think we need to be doing in order for them to for us to help and to organize and join forces on a global stage?
Well, in my work with and my conversations with people and organizations in low and middle income countries, a few things have struck me. One is that the experiences and the needs of mothers, babies, and families at that very early stage in the child's life, in pregnancy and immediately postnatally, those experiences are very, very similar, and those needs are very, very similar in high-income countries and in low and middle-income countries. The human suffering that comes from not being well psychologically and mentally at this time, from suffering environmental adversity, at that time as the adult, but at that time as the child as well. And mothers having suffered environmental adversity when they were children, impacting on them when they are mothers. All of those experiences, those human experiences, are extraordinarily similar across these nations. The difference is, of course, the resources available to support and nurture people. We need to adapt. We humans need to adapt our responses somewhat in response to those resources. But the importance of this field is equally great. So the human experience is the same. The importance, the need to do something about it is essentially the same. And I've been struck by the way in which people, organizations, even politicians in low and middle income countries are coming to appreciate the importance of these issues for their populations. So the level of priority this is given may not be exactly the same, but there is a growing understanding that if you want to invest in the future, our human capital, our human populations are the best investment we can make in the future. And if we want them to be well-functioning and productive and working collectively and collaboratively in a trusting way, which is the most effective way in which humans work, then we need to nurture those populations when they are very young, in pregnancy and postnatally. How do you do that? The solution is the same in high and low and middle income countries. You do it via the primary caregivers, mainly the mother, but the mother's human environment, the family, the partners. That's how you approach that. That's how you build a better future for your nation. The detail of how you do it, how do you spend money to achieve that, that is different. In low and middle income countries, we now have very clear models of care which have been scientifically proven to be effective as well as cheap to implement, to create supportive, nurturing relationships for people who are at risk of mental health problems, mothers who are at risk of mental health problems, or who are suffering from mental health problems. And the research really is very clear that these are not only clinically effective, that these help these populations, but these interventions are cost effective as well. So I think we're going to see, and we're already starting to see, I think we're going to see a huge growth in low and middle income countries implementing these sorts of interventions, in addition to the political changes that low and middle income countries can make. So, for example, I spoke in one of the earlier recordings, I mentioned reducing political moves to reduce domestic violence and reduce poverty, particularly amongst parents of very young children. These can be targeted actions by governments in low and middle income countries, and it's been shown that they can have an impact. So I think these are exciting times, and I think this is as much as a priority for all humans across the world, whatever the economic situation. This is a human priority.